Now, every winter, the Queen Alexandra Hospital in Portsmouth struggles. It's often forced to declare several critical incidents. Queues of ambulances park up, unable to offload patients, and people end up waiting hours in A&E. But a £58 million project is aiming to solve part of the problem by building a brand new emergency department with more space, more facilities. Our health correspondent Alastair Fee has been given a look around the scenes as the new site takes shape.
This department has been built from the ground up specifically for emergency care of patients with the greatest need.
For many, hospital care starts in A&E, but all too often that has meant long waits, whether you've walked in or come by ambulance. This build has been much anticipated and is finally taking shape. It's hoped it'll radically improve patient care.
I mean, you can see looking around already that there's a lot of natural light that is suddenly coming into the emergency department, something that we don't have at the moment. We are currently in what will be our majors area of the department, so all of these cubicles are now cubicles, whereas at the moment we're in curtain bays. We now have cubicles, which straight away improves our ability to control infection and things like that, and this majors area will be certainly better for patients and staff.
The existing department, here since 1979, has struggled to manage the rise in demand. Much of it wasn't designed for emergency care. The target wait of 4 hours is often missed.
Our resuscitation room has double the capacity of our current one, which means we'll be able to deal with the most sick and acutely unwell patients in a more timely fashion. There are definite advantages throughout, kit-wise and space-wise.
It's hard to imagine now, but this will be the imaging department. There'll be 2 CT scanners in the rooms to my left. Just down here will be 3 X-ray machines, and this corridor will take patients to resus. The one image that haunts the QA is those ambulances queuing outside A&E. Are you confident that this new facility will reduce that pressure?
I think flow through the organisation is a problem, and as you said, it's experienced by having patients in the back of ambulance or waiting in the emergency department for longer than they should. I don't think that this necessarily is the solution to the whole problem, but absolutely part of it.
Are staff excited?
Very. All the staff are hugely excited to be part of something that's really, once in a generation, to have a new department like this, that they've been involved from the beginning in designing and making best for them and their patients.
The team here say they are on time and hope to open in the winter, right when they need it most. Alastair Fee, BBC South Today.